My name is Jenny, and I'm a research assistant with the Addictions and Concurrent Disorders Lab at UBC, and I will be your moderator for this workshop. The session is about MINDER, which is a mental health app for post-secondary students, and it will be presented by Angel, Borna, Melissa, and Dr. Vigo of the Mental Health Systems and Services Laboratory at UBC. And now I'll pass the floor to you guys for further introduction and to begin.
Everyone, thanks so much for joining our workshop today. We're going to be giving you a brief presentation about our mental health and substance use MINDER, the app MINDER that we've developed. And then we'll also actually, as we're making an adaptation for secondary students, we'll also talk a little bit about kind of how that adaptation process is and the changes that we've made. So we can go ahead and get started, unless, do we want to do a brief round of intros, Melissa, Borna? Yeah, no. Okay, I guess we'll just go for it, Borna. Yeah.
Okay. Hi, I'm Borna. I'm the coordinator for the Younger Minds project, which is, as Angel mentioned, is the adaptation of the app for high school students.
I'm Angel. I'm the research manager for the Mental Health Systems and Services Lab. And Melissa.
Hi, everyone. I'm Melissa, and I'm a research assistant in the lab working on the development of the MINDER app. And sorry, Angel, I just want to clarify, can you see like a blot on my screen? Is it like
no, we're actually all good. It looks good.
Okay.
Great. So to get us started, I'll just give a brief overview of the Student Mental Health Project. It's a 4-year multi-site study at UBC, SFU, McMaster, and U of T for Canadian university students. And it consists of multiple parts. One is a needs assessment survey that was built in collaboration with the WHO International College Student Survey based out of Harvard Medical School. And so that needs assessment survey was active at all 4 sites for various different periods of time, kind of assessing the current mental health and substance use needs of university students. And then from that needs assessment survey, we've kind of seen the major topics for both mental health and substance use come about. And we drew from those topics to help build some of the interventions in the app that we'll be focusing on today. This project was also funded by Health Canada. So if we'll go into the next slide, I'll give you a little brief overview of the MINDER app itself. It consists of 4 main components. The main part is a chatbot that consists of various different pre-programmed chatbot scripts and videos that delivers over 30 different activities based off of cognitive behavioral therapy, negative cognitive training, mindfulness, and psychoeducation. As you can see there, that's a picture of our home screen, which we'll go into a little bit more later when we talk about the different pieces of content that the app has. The app also has a peer coaching component. And so this is to help users who are going through the app have some guidance. They're paired with a real UBC student who is trained in both psychosocial support as well as the different app content so that they can give guidance on and suggestions on where to go in terms of the app resources they can use. We also have a services component that was in collaboration with another lab here at UBC called My Hearts Map You. And what that does is they go through a short triage survey that matches users with resources across several categories. So that might include academics, sexual wellness, mental health, substance use, based off of their current needs and preferences. And they're able to go through and be suggested to both on and off campus resources. They're also able to filter on a variety of different tabs according to their own preferences. So if they would like something more virtual or in person, paid or non-paid, they're able to filter through those kind of resource categories to find a resource that best fits their needs. We also have the 4th component here within the app called Community. And so this is a directory of student groups or clubs at the university that can be filtered by various different interests for the students. And so this really came out of our student engagement process, as students said, you know, an app is all good and great, but at the end of the day, I want to be able to make in-person connections. And so if we go on to the next slide, we can talk a little bit more about our actual co-development with university students. So the MINDER app itself is targeted for the general university student. We aren't built for a clinical population. And so in that kind of development process, we really wanted to make sure that we were engaging as many students as possible to really make sure that we're building an end product that is something that they will use and that they feel like is addressing their needs. And so that came across in a lot of different variety ways of engaging students. We had a lot of student team members that were actually involved in the development and writing of our content. We also had a student advisory committee of 54 students that included representatives from clubs and organizations across campus that had to do with mental health and substance use to advise us on kind of the direction of the content, the usability of the app. So that had 7 meetings across multiple years. We also had a virtual boot camp with 40 students where students were able to go through an online survey and download the app on their own and provide feedback through a couple of questions about what they liked about the usability of the services, whether or not they felt like it was clunky or not easy to understand. We then moved on to a pilot trial with 101 students that trialed whether or not the randomization kind of logistics for a randomized control trial were able to work seamlessly. We also had a series of focus groups from both the virtual bootcamp and pilot trial that sought to understand even more from those students, what exactly is it that is maybe preventing you from using certain sections, what might be contributing to areas of confusion as to what certain sections are for. And that culminated in our randomized control trial of close to 1,500 students to test whether or not the MINDER app is effective. Melissa will talk a little bit more about that randomized control trial a little bit later, but I'll talk a little bit more in the next slide then about the actual services and the content that we have in the app. So this is an overview of all of our chatbot content. As you can see, it might be a little overwhelming at first, but a couple of things that I want to highlight here, like I said, this is our homepage. We really decided to take a holistic approach because there are so many kind of complexities and comorbidities between both mental health and substance use. So you'll see that we organize the home screen based off of 6 islands: university life, wellness, relationships, sadness, stress and anxiety, and substance use. And so the idea here is that a student can come into this homepage and click on whatever kind of category they feel like is most relevant to them. They don't have anything that they need to have to go through, right? It's all self-directed. For students who might be feeling a little bit more unsure about what they want to click onto, they can click on the Explore chat. And so they'll go through a kind of self-guided chat that allows them to be directed towards certain pieces of content. So if they say, oh, I'm having kind of issues with relationships, the chatbot itself might suggest certain things within the relationships category. Yes, and so then focusing specifically on the substance use interventions in MINDER, we focused on alcohol, cannabis, stimulants, and opioids. And so the kind of content within this map focuses kind of on certain types of categories. So we have understanding my specific type of substance use, and that draws from motivational interviewing, talking about situations, thoughts, feelings, really trying to dive in deep about their use and their thoughts about their use around any of the different substances, and trying to do an assessment for readiness to change and maybe helping to set some SMART goals for those who are wanting to change. We also have more psychoeducational focused material about all the 4 different substances that try to provide more normative feedback, give them a little bit more idea about lower risk guidelines and behavioral strategies. We also have a tracking my drinks drink tracker where they're able to interact with it in real time, set a drinking goal and come back to it as they might be engaging in drinking behavior to keep coming back to that goal. We also have a setting substance use boundaries video that helps them kind of identify their boundaries and work on those assertive communication skills to consistently set those boundaries. So if we go to the next slide, I can show you a little bit about the actual substance use map. So when a user kind of clicks into that substance use island, this is what they see. all of our content is laid out in this kind of map format, and they're able to go through and click on the things that they feel like are most useful to them. You can see the ones that are the main pieces of content are now highlighted in orange. And so those are unlocked at the beginning. They can go through any of those. And by going through those pieces of content, they then can unlock the things they're called summaries, which allow them to come back at a later time and get the information kind of in a quick summary. We go on to the next slide then. This is also an example of our normative feedback for alcohol use. And so students, as they're going through the chatbot content, might be asked, how many drinks do you have on a typical day when you're drinking? And depending on their response, the graph on the right will change. And so they'll also be asked, how much do you think a male, female, or, a general UBC student might be drinking on a typical occasion? And we're able to draw from the existing survey data that I talked about before to provide them kind of feedback in terms of, oh, this is what you thought, but actually, the normal typical UBC students actually drinking this much, and you're actually drinking more than 99% of general UBC students. And in order to try and kind of quantify how they're thinking about kind of that general alcohol use. Great. So I'll pass it over to Melissa to talk a little bit more about our CTA.
So like Angel mentioned before, our co-development process kind of ended in a large randomized control trial. And because it was in a general population of students, we needed quite a large sample. So we had 1,489 students from the UBC campus participate in this study. And essentially they were told to use the app however they saw fit. So we didn't have specific things they had to go through during their time in the study. The only real requirement was that they needed to do the baseline and follow-up surveys. So they were given gift cards for completing those surveys, but otherwise were not incentivized to use any specific parts of the app themselves. And this was because we wanted to see how the app might be used if you were just simply to offer it in this format and allow people to choose what they thought was best for them. So these are some of the main results from our trial. So we just published this recently in JMIR, but overall we found that there were small effects in reducing anxiety and sadness, or I guess depression symptoms on the GAD-7 and the PHQ-9. We also found some reductions in typical number of drinks consumed when drinking alcohol, although on the audit C, we did not find significant reductions there, though it was trending that way. In terms of overall well-being, we found improvements in the Warwick well-being scale for students, and also we found reductions in use of cannabis. So you can see kind of here some of those changes we found. And again, they're relatively small effects, but this was a general sample of students. So again, not people meeting clinical criteria for having disorders or anything. It's just any student could register to participate in the study. So something then, moving beyond, we had this initial app that we had designed for university students. We saw that it works. It has an effect in improving mental health and substance use for students. But then the question kind of becomes, how can we continue to improve the app and make it better, I guess, to try and have a larger effect and try and support even more students than it kind of is already. So one of the ways we went about this was trying to adapt the app specifically for certain subpopulations of students, because like Angel described, originally we had worked really closely with students in the co-development process, students who were largely involved in mental health organizations or substance use organizations, but we wanted to try and focus in on some subpopulations of students that we know might be more greatly impacted by mental health or substance use, or may have challenges in accessing supports. So the specific subgroups that we were interested in during this phase were students who use substances. And I think the reason for this was, although we had worked with certain groups initially during our co-development process, we really wanted to see how we could refine our content and possibly improve it to address the wide range of substances that students use, and also kind of the needs and the way we could improve our content for those students. LGBTQ2S students, racialized students, Indigenous students, international students, and also students with disabilities. So understanding that, we didn't have, ability to go into huge amounts to focus on each of these, but we did want to try and engage with at least certain stakeholders and students from each of these groups, and then see generally how we might be able to make some improvements to the content that we had and the way our services were offered. So we did this in several ways through focus groups, stakeholder and expert interviews, mainly with people from UBC and who worked closely with students from different groups. We had additional groups we added to our student advisory committee who were kind of leaders amongst these different subgroups. And so in terms of what kind of came out of this, we kind of found that there were actually a lot of similarities and key themes that came out across a lot of these groups together, which is why we ended up actually kind of combining these themes and not necessarily reporting them based on each of these different groups, and instead kind of seeing how all of these key themes came together amongst the subgroups, and then also in terms of the content we developed specifically. So in terms of the themes, we found that there was cultural and generational differences in support and awareness about mental health and substance use issues, which I don't think was a surprising thing to find, but definitely something we tried to consider as we were trying to adapt our content. We found that in particular, there were challenges in recognizing and expressing emotional challenges for some of these groups. And we know that's a really big problem when you go to try and access services. If you can't even recognize, your own emotions and the problems you're having, it kind of makes it impossible to go to that next step and actually go and reach those services that you need. We heard that there was a lot of challenges navigating resources. People didn't understand, how the university health systems worked, how the general health systems worked, what the differences were in between the types of services, whether it be like counseling services, medical services, emergency services, crisis lines, all of those things. They weren't sure, what all of them meant, and also when they should access each of those different types of services. And finally, just the importance of having peer and community support. We heard that often, students are first off going to talk to their friends about things when they have challenges. It's not, usually immediately reaching out to professional services, but often they're the ones supporting their friends, and they don't necessarily have the tools to know how to do that and to have those types of difficult conversations, which I think pretty much all of us have had at some point. So to try and address these themes, we developed a number of different content areas that we have now finalized and are putting into our app. So the first thing was content around helping a friend with mental health and substance use. So basically how to support somebody, how to have a conversation like that with somebody that you're maybe worried about, and including some specific parts about how you might navigate cultural differences if they exist. We also increased some of our content around stigma. So we had content before around stigma around mental health, but we realized we were actually lacking addressing some of that stigma around substance use. So we added some content surrounding that and kind of some language people can use around substance use to have those types of conversations and to be more supportive of others. We also talked about factors that impact mental health, including, and I guess substance use as well, including identities and intersectionality and the role that plays. And sometimes those things are out of our control, but being able to recognize how everything can sort of impact how we're doing we included new content around communicating emotions. So again, getting that first step and being able to reflect on what's happening for you. And I think having those words really can help in, later on trying to access services and supports. We talked about content around navigating types of resources. So explaining the different types of services available to students, what each of them do, when you might access them, and also specifically how to make the most of their university provided services. So whether that's, accessing their insurance or things like that. And finally, content on reaching out to others. So how you might go about having a conversation and who you might choose to talk to should you feel like you need support. So I guess we wanted to take a moment to kind of pause then, because a lot of our work is really around this co-development process and how you should go about adapting content and interventions for different populations. So we wanted to ask the audience to kind of think about, either in your own work, if you work in intervention work, or these types of programming, or even just thinking about our intervention, which, originally we talked about for university students, but what factors should be considered when adapting these interventions for different populations, including, adults, for example, youth, so, people younger than university age, young adults, and also other contexts. What types of things might you need to consider before trying to offer a intervention in a different way? So if anyone wants to, you could think about it for a moment, but if anyone has anything to add, feel free to put some of your answers into the chat, and then maybe Angel or Borna can read them because I can't see the chat.
I guess we're also open to any kind of thoughts on maybe how things may be different when approaching an intervention for adults or youth, or in other contexts. For example, maybe adapting to different country or cultural contexts and things like that.
I see one here in the chat from Jenny: cultural upbringing, workplace and school dynamics, as well as having a social support system.
Mm-hmm. Yeah, I think definitely those are great points, because when we think about, being able to access mental health and substance use services, we know that that's not the same for everybody. There's lots of things and barriers that can get in the way, that can prevent people from accessing services, from even knowing what services are, from being able to afford services, or, be able to go to appointments to access care. So I think all of those are really important considerations.
We also have two more here: socioeconomic factors, which definitely kind of overlaps with what you just talked about, Melissa. Users who are minors, which we'll discuss shortly in a few slides, which is the other kind of project we're working on to adapt this for high school students. And Jenny also added living with family versus living alone, which definitely applies both, especially in the high school or minor context, where most students will be living with their families, but also in the university context as well, where there's a mix of kind of living conditions and environments.
Yeah. So definitely, and I think something that we really wanted to highlight here, and based on our experience, working with different populations, doing this co-development process, is that it really just is so important to consider the population that you're working with, and actually getting to hear people's voices, hear about their experiences, hear about their needs before, jumping into designing these complicated interventions. Because I think Angel, Born, and I all can say confidently that there was things that we were wrong about throughout the process when we were developing content There was things that we thought would be really great and were just a total flop, like things didn't align with students, or there was things that we never even considered that were really important and great ideas. So I think just not underestimating the power of people to kind of know what they need and consider those different factors when you're trying to make something work for a certain population. So I guess in terms of these specific possibilities in terms of our apps. So some of the things we might think about if we were adapting this for adults would be digital literacy. So this is a smartphone app. We know that there, for university students, it's not a huge concern that people know how to use smartphones, but for older adults, it might be. So that's something you might have to consider in an intervention. Things like language and tone. So whether the tone we've set for university students, whether that would align with people who might be older or have different kind of language understanding, and also access to care, which I think was brought up. So we know in university, there is a lot of resources because they are students that they have access to, but as soon as you graduate, some of those options go away. The kind of university funding and campus services can be a lot more difficult to access. So considering what options are available for adults, for youth. So we'll talk more about this afterwards, but the types of issues faced by youth might be, very different from the types of things adults face. The language and tone, obviously, the way they communicate. It was hard for us because it's been a few years since all of us have graduated from high school. So trying to kind of think how we can, sound to resonate with the youth without not, trying to age ourselves too much. Things like parental guidance. So we know that at this age, youth are still under the care of their parents, which means that we need to consider their role and their kind of ability to supervise their kids, and also the fact that they'll be living at home most likely, which means that things like audio and video calls, others might hear them. So, options such as, texting might be more preferred for people who don't want others to hear conversations surrounding mental health. The legality of substances was something we had to deal with because obviously for university students, alcohol and cannabis are legal, but for high school students, they're not. And also the risk of harm and responsibilities. They are minors, what to do if, we find out someone is facing abuse or that they might harm themselves, because we have a certain responsibility as adults to report those types of things. And also just in terms of other contexts. So, if we were to move outside of BC, outside of UBC, are there location-specific differences? Are there different health systems in place that might impact the services that are available? And also just considering stakeholder input, I think, at all of these phases to really ensure that, again, although there is a certain amount that we know based on our work, there's lots of things we don't know, especially when we're talking about other contexts we haven't worked as much in. So really relying on stakeholders at different levels to help guide you through these types of adaptations. And I'll now pass it over to Borna to talk about our project with high school students.
Great, thank you, Melissa. So as we mentioned earlier, we also have a parallel project running in the lab, also funded by Health Canada, with the goal of adapting the MINDER app for university, taking it and adapting it for the high school context. So before we dove into that and made any actual changes in the app itself, with the content, the components, any of the resources, we once again want to follow a similar kind of co-development approach. As we mentioned in the past few slides, recognizing the importance of actually hearing from the target population you want to make the intervention for, hear what they would want in a resource like this, what things they think should be added, removed, changed, etc. And the majority of that took place through student engagement sessions that we did. So an overview of all the engagement we did, basically to better understand the entire mental health and substance use landscape of secondary students. We held these sessions, which were essentially qualitative focus group sessions at a variety of schools across BC. So we had 14 sessions to date involving 12 different schools. So to make sure we kind of targeted and heard from as wide of a variety of voices as possible, we visited public schools, independent private schools, as well as alternate schools. So to make sure that we're kind of assessing the landscape of these issues as accurately as possible. especially because the end goal of the app is to make it available widely for free for all high school students. So we did that. We engaged with 108 students as well as 13 staff members. So these staff members were, most of them were counselors, but they're also teachers, sort of admin staff, to make sure we're also getting their perspective on sort of these issues in the schools and what things that they think would be useful, whether it's in the app itself or how an intervention like this can be sort of integrated into the high school environment. And the scope of these sessions and the kind of questions that we asked were quite broad. So we covered things like asking students how mental health and substance use were discussed among their peers, at their school. So what kind of education they received, what things they found helpful when it comes to these topics, what things they found perhaps not helpful, or maybe especially with the tone and sort of approach and the framing of the discussion, as well as for substance use specifically to focus on it, which we'll go into in the next slide as well. What substances were sort of present at the schools, or what things were kind of in the dialogue and mentioned among peers, as well as more specific questions about any kind of digital tool or intervention. So what apps they already used when it comes to mental health or mindfulness. Again, what things they found helpful in apps like that, what things they would want to see or use in a digital tool like this, to make sure that as we started the actual adaptation and changes within the app and the content, we were basically taking as much feedback as possible and having that in mind before we started the actual work. We also have other types of engagement as well throughout the sort of year and a half process that we engage with the students. We had students come to work with us at our lab in both the summer and winter. So those are more kind of intense, focused, week-long periods where students would come work with us. They would both sort of see what the psychiatry department and the lab was like, what kind of work we did, as well as do more specific kind of work with the app itself. So looking at actual scripts in the app, giving us feedback on that, and what they think could be changed when it comes to tone or length, et cetera. We also had a virtual student advisory committee where we gathered students from across the province, so both in Vancouver, on the island, from northern BC as well. And we asked them again more kind of specific questions about content we had developed up to that point, and getting more iterative feedback for us to go back, work on the content, and then again, present it and get some more feedback on it. And we also had a UI and UX feedback survey go out digitally, which is focused entirely on just the kind of look and feel of the app, where students could sort of see different screenshots of it, how it looked, as well as some videos that we had created at that point to give more feedback on sort of how it felt to use as an actual digital tool or application. And to focus more on the substance use sort of portion of these discussions, we extracted some common kind of themes and discussions that came up at the various different schools we visited. So when it came to substances that were actually mentioned by the students or the teachers, by far, I think might be surprising to those of you who work in the secondary school kind of environment. But the most common one, which I think at every single school we visited was the most common topic, was vaping. So that was mentioned by students, by teachers, by counselors, as being the most common thing that was coming up when it comes to any kind of substance use. And as we'll discuss shortly in the next slide, that was a topic that we actually didn't have in the university version of the app because it hadn't come up as frequently among those students. So that was kind of the first indication that we have this new and very crucial sort of piece of content that we need to work on and add to the high school adaptation of this app. Things like cannabis and alcohol also came up. Caffeine came up quite frequently as well. So whether it was coffee or energy drinks, and some students were kind of reflecting on the reasons for their use, whether it was to actually keep them up late at night, for example, to work, or whether it was more just to fit in because it seemed like something that most people did. And we also added content about that as well, which we'll see on the next slide. Some other ones that were not quite as common that came up in some of the various different school engagements were things like supplements. So for working out, and even steroid use was mentioned, as well as some more brief and rare mentions of psychedelics, as well as painkillers. When it comes to the discussion of overdoses and opioid use, it was not as common as things like vaping and cannabis and alcohol, but we did hear in a variety of different schools that was still something that was coming up, whether it was in the community, in families, or in some rare cases, even at the school. And in one case, in one of the schools, there was a mention of an overdose as young as a grade 8 student, which was brought up by some of the counselors. So there was definitely that issue was present at the schools, and we discussed that with them as well to sort of integrate that into the general substance use content. But we also saw some sort of promising and positive signs as well of the students' pre-existing knowledge and education about substance use in general. So we actually saw pretty frequently that students were quite aware of sort of the use of substances as a coping mechanism. So whether it was to cope with issues that were going on in school, at home, we heard it quite frequently that students were aware of that sort of aspect of substance use and that how that could potentially fuel further usage. But we also heard other motivations as well, things like peer pressure, reducing anxiety, loosening up, for example. And one interesting one that came up actually as well was that during the pandemic, we heard from a couple students that there was an element of community actually sort of that was associated with substance use as well because of the very limited social contact that was possible during that time. It was sort of an activity that seemed to, at that time, bring students together. Some of them were aware of that as well, potentially driving and motivating further substance use, as well as more other themes like rebellion and kind of family history of use as well. When it comes to substance use education, some students were satisfied with what they were receiving, others were not. When it comes to actually the feedback we got in terms of what could be changed in terms of the approach or framing of the substance use education, we heard two common ones, which were what they would recognize as elements of kind of bad education, which was sugarcoating and also dividing students into users and non-users. So kind of the second one, adding some element of stigma to use, which students were not quite happy with, as well as the first one being kind of maybe not delving as in depth as they would have wanted to with these discussions in an attempt to perhaps sugarcoat it or not kind of get too in the weeds with this more sensitive topic. And we also discussed with them what they would actually want in a substance use tool or content in the app as well. The most common one was that they wanted sort of positive and empowering framework and framing for the content rather than a more negative kind of fear-based one. So we kept that in mind as we were developing the content, which we'll see in a couple of slides, as well as things like alternate coping mechanisms. So because a lot of them were already aware of substance use being a coping mechanisms for various different issues in life, they wanted to sort of get other mechanisms they could, or coping mechanisms they could use. So we also integrated that into the content as well as recognizing overdose signs. So the students mentioned, for example, if they're at a social gathering or party, they want to know how to both recognize signs of potential overdose as well as what to do in that situation. So we also developed content to address that. And as well, just like we heard in the sub-pop adaptation in the university context, teaching sort of support for how to support friends as well. So if the students themselves were not using substances, if they had friends who did, they wanted to sort of get some of the tools and be equipped to know how to have those discussions, how to help the friends who perhaps want to stop using substances, as well as, again, sort of the more safety and harm reduction approaches as well. So for other adaptations as well, in general for the app, when we changed it for, or adapted it for the high school context, we developed quite a bit of new chatbot content, which we'll see in a few slides. So a lot of that was focused more on the new topics that we heard in the high school engagement sessions that we didn't have in the university app. So again, things like vaping, caffeine, and a few others, which we'll see shortly. We also got feedback that, for example, some of the chatbot scripts and videos were a bit too long. Maybe they lost some interest. We made some of those shorter. We developed new video clips as well that were animated by a team at UBC to deliver the content and psychoeducation within the app. Some personalization and peer connections as well as a community forum. So previously, as we discussed earlier, the community section of the university app was a directory of clubs at UBC where students could sort of form those in-person connections in their community. But for the high school version, we had to change that quite dramatically to make it appropriate for both the age of the students as well as the fact that it was meant to be a province-wide kind of app. So we heard quite frequently from students that they were going to places like Reddit, for example, online to ask questions or to read about mental health and substance use topics. And we heard that pretty frequently. I think one kind of strength of that, or one reason that they were drawn to that, was that it was anonymous. So they weren't worried about getting in trouble, perhaps. So we decided to take that kind of format and build a community forum within the app itself. So it's anonymous. The students submit questions to our team. We vet them, approve them, and then post them. And then trained peer coaches and members of our team will then answer those questions. So we kept kind of the framework of that forum. So kept it anonymous. They can post it digitally, whenever they want. But instead of anonymous strangers online answering them, we hope that having that more kind of reliable evidence-based response will be kind of engaging for the students and want them to ask more questions within the app itself. and as we'll see shortly in a couple of slides, we changed the approach and the framework for the substance use content to make it more motivation driven. So rather than focusing on each specific substance by itself, as we did in the university app, we took a more holistic approach and tried to sort of motivate students and encourage them to just reflect on the reasons for substance use and the motivations behind that, to take a more general approach rather than focusing on one particular substance at a time. Though we did also have more targeted videos and chatbots, as we'll see in the next slide, as well as linking reasons for substance use to more personalized suggestions. So again, trying to find more alternative coping mechanisms and ways to sort of take the load off from substance use and use other approaches to deal with the issues that they were going through. So this is a very busy overview of all the content we have now in the high school version of the app, and actually one that we've launched a pilot study in 8 school districts across the province right now. The students can use the app and test it, so they have access to all this content right now. So you can see a lot of the content we adapted from the university version, so things like time management, setting boundaries, navigating relationships are things that are applicable to most people. So we just adapted those scripts and made them more kind of relevant for high school students. But we also created a lot of new content, which you can see in all the highlighted bullet points there. So things like vaping, caffeine, learning about overdose, debunking overdose myths, social media use was another big one that came up. So these are all content, pieces of content that are more applicable to the high school context and things that we heard almost entirely from just the engagement sessions we had with the students. So we took that feedback, went back to our lab, and then created all the new chatbot scripts and videos to have it in the new version of the app. And this is one of the substance use scripts that we have right now in the app, the reasons for substance use script. So the idea behind this one, as I mentioned, is to sort of motivate students to reflect on the reasons and motivations for their use. So we kind of go through a 4-step process in the script. And because it's a chatbot format, the students can engage with the chatbot. They can sort of tap on different response options based on their own context and what they're going through, and their own reasons for use potentially. And based on that, the app will adapt and sort of take them down the path that's most relevant to them. So the first step for the script is to reflect on the situation. So we encourage students to sort of think about what substance was used, the situation they were in, who they were with, how they were feeling, just to kind of prime them to think about and reflect on the use itself. The second step is to then identify reasons for using the substances. So based on some of the feedback we got as well in the schools, we present them with some different kind of potential reasons that they could be using to get them to, again, reflect and for better understand what those deeper motivations may be. So whether it's coping with feelings, enhancement and boredom, more kind of a social reason to connect with other people and peers, conformity, so things like peer pressure and fitting in, self-expansion, as well as performance. So based on that, they'll tap on the response that's most applicable to them, and then be taken to the next step of the chatbot, which is addressing the harms of the substances themselves. So based on what they respond with, we inform them and give them some more tools and education on the actual risks and harms of some of the substances, as well as the risk of contamination and overdose. And we also highlight the fact, again, based on some of the feedback we got from the students, that they, of course, should not be taking substances they're unsure of, or any kind of unregulated pills or drugs that they come across. And the final step in this script is to address the actual specific reason for use. So first, we validate their feelings and concerns, so they know that that part is something that they can work on, and there's a lot they can do to sort of address those reasons themselves, as well as brainstorming other alternatives to substance use. So again, addressing that kind of deeper motivation for the use in the first place and presenting them with other activities or other things they can do, whether it's things they can do in real life or directing them to other parts of the app and other sort of scripts and content that they can go through to perhaps kind of fortify and strengthen the current things that they're going through right now. And then, I think we...
Sorry, Bernard, I skipped through that slide, just we need to wrap.
Oh, perfect, okay. So we'll wrap up there. We want to thank our team and all of our collaborators across the different sites, as well as thank Health Canada for funding the project.